Hello guys, this is Dr. Hazama. Today we are going to learn about the joints. We will identify the functions of joints. We will distinguish between joint classification, and we will identify the degree of movement of joints in our human body. So, joint. What is a joint? Means how you will define what is a joint. Joint is basically when two bones meet, then this meeting is called the joint, or it is the connection or articulation in the skeleton between any of its rigid components part, whether bones or cartilage. So if you define in a easy way, then you can say it is a meeting of two bones, or in some cases there are more than two bones. We will call this as a joint. So arthrology. Arthro means a joint or any articulation. Ology means a study of that thing. Meaning arthology is a branch of anatomy which deals with the study of joints. So arthrology is the science of studying joints. What are joints? As we discussed earlier, a joint is where two bones come together. So we are going to do a joint classification. There are two ways of classify the joints. First is the functional classification, and second is the structural. On the functional, we will classify on the basis of immovable, slightly movable, and freely movable. Synarthrosis, amphiarthrosis, and freely movable diarthrosis. Whereas in structural classification, we classify the joints on the basis of their structures, like which material is present that binds the joint together. Fibrous joints. First one is the fibrous joints. They are immovable. The bones are connected to each other by a fibrous connective tissue. Whereas cartilaginous joint, they are slightly movable. Uh, Cartilaginous joint have the hyaline cartilage. They are present in our coastal areas, in our between the sternum and the ribs. Third one is the synovial joints. They are freely movable. We will define these separately in next coming slides. Classifications of joints. Structural classification. We have discussed there are fibrous, synarthrosis, and synostosis. What do you mean by synarthrosis? Synarthrosis means that there is no movement in the joint, and synostosis means that the bones were separated when the with the development the bones become fused with each other, and thus fixed joint is made. So immovable connect bones, no movement. Example are the joints present in our skull and the present in our pelvis. Cartilaginous joints, amphiarthrosis, means that they are slightly movable. Bones are attached by cartilage. There will be a cartilage between two bones. A little movement, like a spine or ribs cartilages, there is a little movement. When you breathe in, the cartilages do some movement. Third one is the synovial diarthrosis. Diarthrosis means that freely movable. There is much more movement than a cartilaginous joint and fibrous joint. Cavities between bones are filled with synovial fluid. It provides a lubrication and it protects the bone. Structural classification. We will classify on the basis of the structure present between them. First one is the fibrous joint. Fibrous joints having fibro connective tissue between them. It is made up of collagen fibers. It joins the bones. There is no joint cavity. Made up of fibrous connective tissue. Usually synarthrotic, means that there is no movement in fibrous joints. There are three types of fibrous joint. First one is the sutures. These are the sutures present in our skull. These are the sutures. The skull become bone in middle age. They again fuse with each other with the progress of age. Second one is the gomophosis. This one is the type of gomophosis, means that teeth. They are example is the teeth, whereas the periodontal ligament holds the tooth in its place. You can see that there are ligaments, fibroconnective tissue here that hold the tooth in its place. This is second type. Third one is the syndesmosis. You can see here, this is a fibrous connective tissue present between two bones. Short ligament bind two bones, radius ulna and tibia and fibula. You can see here, this is the tibia and this is the fibula. Between them there is a interosseous membrane which is made up of fibroconnective tissue that hold these bones together. Structural classification, there is another parts, bony joints. What are the bony joints? Uh, Synostosis. First, there are what is synostosis? Two bones once were separated, but with the progress of age, they became fused with each other. Like we have frontal bone, where you can see that sutures become synostosis with the progress of age. And epiphyseal line. There is a line in our bone, that is epiphyseal line of cartilage, which is made up of hyaline cartilage, but with the progress of age, this cartilage is converted into bone and thus fused with epiphysis and metaphysis, fuse these together. You can see that between frontal and the parietal we have serrate suture. We have the second one is the lab suture. You can see the direction of the suture, the shape of suture, and third one is the plain suture. You can see here. The structural classification, again we are continuing with that. What are the cartilaginous joints? Second classification. In this joint there is a cartilage that binds between two bones. There is no joint cavity like present in synovial joints. Usually amphiarthrotic, means that they have slightly movement. We have two types: synchondrosis and symphysis. Synchondrosis having hyaline cartilage. Uh, in them, hyaline cartilage will join two bones. Like we have this one, costal cartilage is present between two bones, like sternum and ribs are. They have the hyaline cartilage. You can see costal cartilage here, here. There is a present of hyaline cartilage. Costal cartilage is example, and second one is the epiphyseal plate of cartilage, which is discussed earlier, that it is a cartilage which help in lengthening of our bone, but become it become to bone with the progress of age. Second is the symphysis. It's a fibrocartilaginous fibrocartilage joins it. like this one. This is a fibrocartilage. Here, here, here. There are two examples of this one. First one is the pubic symphysis, where fibrocartilage join these two pubic bone, and second is the intervertebral disc. Here you can see that it is connecting the vertebrae with each other. Now we will define these synovial joints. Synovial joints has a giant cavity. You can see that this is a cavity, and this is a cavity. It has the synovial fluid. This space is filled with the synovial fluid. Again, this is diarthrotic, means that it is a freely movable joint. Examples are shoulder joint, uh, knee joint, elbow, hip joint. These all are synovial joints. Now, what are the components of synovial joints? We will discuss these. Like it has the joint cavity. You can see here, this is a joint cavity containing synovial fluid. Here we have the synovial membrane covering the synovial cavity. Again, synovial membrane has synovial membrane is a part of joint capsule, means that the joint capsule covering the wall joint, enclosing the wall joint. It has two parts. First one the fibrous capsule, and second one is the synovial membrane. Here you can see that fibrous capsule is continuous with the periosteum. You can see it is continuous with the periosteum, and the synovial membrane will secrete the synovial fluid here in the synovial cavity. Third one is the meniscus. Meniscus actually is a part of cartilage, which has the synovial membrane on it. Its function is its shock absorber. They are present in our knee joint. Patella knee joint has two meniscus, as long as I know. Fourth one is the tendon. Tendon is a regular connective tissue, means which connect the muscle to a bone. You can, as we already learned in our previous lectures, muscles have two parts. One is the belly, and second is the tendinous part. Tendon is that part which attaches that muscle belly to bone. Fifth one is the ligament. Ligament are dense regular connective tissue which attach bones to bone. Here you can see that this is a ligament coming from one bone to another bone. This is the ligament. On the basis of their axis of rotation, axis of movement, we have classified as monoaxial joint, biaxial joint, and multiaxial joint. Monoaxial joint, they can monoaxial joint has movement in one axis, biaxial have two axis movement, and multiaxial have three axis movement. Here you can see that here humeroulnar joint. You can see that there's a hinge type of joint. It has the uniaxial or monoaxial movement. Whereas trapeziometacarpal joint, here you can see carpal bone and metacarpal bone, they are in two axis movement. This is biaxial movement. And you can see the ball and socket joint, just like hip joint and shoulder joint. There is a ball of one bone and socket of another bone. It's a multi-axial, means the direction of movement is three axis. On the shape of joints, we have classified these into. First one is the gliding or plane. You can see here the direction of movement is parallel to each other. This joint is called the gliding or plane surface because both both bones are parallel moving with respect to each other. They are present in our carpal joints. Second one is the ball and socket joint. It's a ball and socket joints. You can see here most movable type. It is a multi-axial type, and examples are shoulder and hip joint. You can see it's a shoulder one. It's a hip joint. This is the ball of femur bone, and this is the acetabulum or the socket of our pubic, our pelvis. Third one is the hinge type, or this one is the uniaxial, means it will the direction of movement will be in one axis, like they can be flexed or extend. You can see that this ulna is attaching with the humerus. This type of joint is the hinge joint. You can see the flexion extension will be going on. This is the humerus. This is the ulna. This is a hinge type. This is an elbow joint. Knee is also a type of a hinge joint. Finger and toes joints are hinge type. Fourth one is the pivot. Pivot means that they will be monoaxial, but they will rotate in one axis. Like if atlas axis joint, this is the atlas is the first cervical vertebrae and the axis is the second cervical vertebrae. You can see that this joint is the pivot joint. When you say no, when you move your head in, just like when you are disagreeing with someone, you are saying no, you can imagine your movement of your neck saying no. This is the pivot joint. This one is the atlas axis joint. Second is the radio-ulnar joint. You can see here. This is the ulna. This is the radius. This will rotate here. This is the pivot joint. Fifth one is the saddle shape. You have seen this saddle in a horse. You can imagine it. This this is a shape of saddle. It's a biaxial, means that it can adduct, extend, flex. Only one joint at the base of thumb. This is a thumb joint. This is a thumb joint. You can see this. This is also called the first metacarpal joint. This is the saddle shape. You can see that concave and convex surfaces. This is the concave shape. This is the convex shape. Whereas sixth one is the condyloid. You can see the articular surface are rounded. There it is also a modified ball and socket joint. It is a biaxial. You can abduct, adduct, flex or extend your joint. Example are metacarpopharyngeal. These are the metacarpopharyngeal joints here. This is the metacarpal. These are phalanges. This is the example of condyloid joint. Now, seventh one is the ellipsoid. You can see that the joint surfaces are spherical or ovoid shape. Not spherical, it's a ovoid shape. It's a ovoid shape. You can see in condyloid they are circular form, whereas in ellipsoid there is oval shape. It's a biaxial, means you can flex, you can extend, abduct, adduct the joint. Example is the radiocarpal articulation. You can say that this is the radiocarpal articulation. This one. This is the example of ellipsoid joint. Eighth one is the compound joint. Compound means that it has more than It is composed of two types of joints or more types, like multi-axial joint. Its direction of movement is multi-axis. So we have an example like temporomandibular, where this is the temporal bone, this is mandibular, this is the temporomandibular joint. It's a hinge type, like we have discussed earlier, and gliding joint. It can make flexion, extension, protrusion, and retrusion, and sideway movements. We have seen that hinge joint is a uniaxial, whereas when both uniaxial are met, they made a multiaxial joint. Types of synovial joint based on shape. We can plane joint. You can see that these are the carpal bones connected with each other. It's a gliding joint. Second is the hinge joint, whereas you can see the ulna and the humerus making a joint that is called hinge joint. Third one is the pivot joint. You can see that this is the ulna, this is the radius, making a joint. D is the condylite joint. You can see here the metacarpal phalanx making a joint, condylite, saddle joint, first metacarpal joint. You can see that this one making a joint, saddle type of joint. You can see the saddle shape, convex, concave. This is the concave. This is convex, and this is concave. Ball and socket joint. The one is ball and second is the socket, where we can see the scapula and head of humerus. Now let's summarize what we have learned so far. Structural classification. We have classified the structural on three categories: fibrous, cartilaginous, and synovial. Bones united by collagen fibers. Yeah, we have discussed earlier. Cartilaginous joint have cartilage, and synovial is a synovial membrane having synovial cavity. Again, synovial membrane, synovial fluid. Now, types of fibrous. We have three types of fibrous joint: sutures, syndesmosis, gomophosis. We have seen that sutures immobile, syndesmosis slightly movable, and third one is the gomophosis, immovable. Cartilaginous bones and united by cartilaginous. Two types of cartilaginous: synchondrosis, having hyaline cartilage, and symphysis fibrocartilages. They are slightly movable, or slightly movement occurs in them. They can, if that is the fibrocartilage, this is immovable. Synovial having 8 types. First one gliding and plane. Second hinge, pivot, condylite, saddle, ball and socket, ellipsoid, compound. They are diarthrosis, means that their movement is freely. I hope you will learn well. I hope I have cleared your concept. If you want to ask any query, you can comment below. I will answer you.